What's up, everybody? My name is Joseph, and I'm always curious about things. And before we had computers in our pockets, I would sometimes keep myself up late at night trying to figure out something or another. And I still get giddy when I discover something new. This pandemic has given me a lot more time for discovery and learning. And while I've been contemplating this video series for some time now, it wasn't until last week that I was motivated to go ahead and get it done. And while the original vision for this series was rooted in discovery and sharing those discoveries, I feel this topic is too important to ignore. So let's get into it. I was on my way to the grocery store listening to NPR when I heard this.
That treatment is not prevention. That right now we have a way to prevent people from contracting COVID, spreading it to others, and getting ill, and that's the vaccine. Vaccines are important too, and we have to remember that prevention and treatment need to go hand in hand.
That's Dr. Lena Wynn. She's a research professor of health policy and management at George Washington University. And in 2019, Time magazine named Dr. Wynn as among the 100 most influential people. Now, hearing this statement on NPR troubled me because I had always thought of NPR as an honest source for information. Well, in the course of my work, I come in contact with a lot of healthcare professionals, men and women who are on the front line fight against COVID-19. In the past couple of weeks, I've heard 5 different stories about someone in the healthcare field within my community contracting COVID-19. But the troubling detail in these stories, in each of them, is that all 5 of those healthcare workers were fully vaccinated and had been for months. It's troubling to me. Jen Psaki, the White House press secretary, was fully vaccinated when she contracted COVID-19. And with that, here's the first fact I bet you didn't know about COVID-19. Vaccination for COVID-19 does not do anything to prevent you from contracting the virus. Now, don't take my word for it. In July 2021, health officials in Barnstable County, Massachusetts, identified 469 new cases of coronavirus. These new cases were found among residents who had recently attended large public gatherings between July 3rd and July 17th. And what was striking about these findings is that 346, or 74% of those new cases were among fully vaccinated adults. These are called breakthrough infections, and they're quite common. And this was a report put out by the Center for Disease Control. Now, the only claim that Johnson & Johnson, Moderna, Pfizer, and the other vaccine manufacturers have made is that their vaccines will prevent serious illness and death. That's it. They have never made a claim that their vaccine will prevent people from contracting COVID-19. With that, it takes us to the second fact I bet you didn't know about COVID-19. Men and women who have been fully vaccinated and contract COVID-19 are carriers and transmitters of the virus. As I stated before, according to the manufacturers and according to the Center for Disease Control, these vaccines' only purpose is to reduce the risk of serious illness and death for a vaccinated person. Need more to convince you? According to the U.S. Food and Drug Administration, this is a quote, most vaccines that protect from viral illnesses also reduce transmission of the virus that causes the disease by those who were vaccinated. While it is hoped this will be the case, the scientific community does not yet know if the COVID-19 vaccine will reduce such transmission. Now, a recent study in the United Kingdom examined the effect of vaccines on transmission more directly and more closely than any previous study. And this study was conducted between January and August of 2021, and their findings will astonish you. The authors of this study found that vaccines did offer some protection against reinfection and onward transmission. However, a person who is fully vaccinated and had a breakthrough infection was nearly twice as likely to pass the virus on to someone else. And they found that the vaccine's beneficial effect on the Delta variant transmission waned to almost negligible levels over time. They found specifically that in people infected about 2 weeks after receiving the vaccination, had a 57% chance of infecting an unvaccinated close contact. And within 90 days, that chance of reinfection had risen to 67%. And this is the same likelihood that an unvaccinated person will transmit the virus to somebody that they come in close contact with. One last fact that I would like to share with you about COVID-19 that I bet you didn't know is that people with natural immunity fare better than those who are fully immunized. Now, for those of you who don't understand these terms, natural immunity refers to individuals who have recovered from an infection of COVID-19. And full immunization refers to individuals who have received at least 2 doses of a COVID-19 vaccine. Most recently, the CDC and other leading public officials have been downplaying natural immunity and encouraging everyone to get a vaccine regardless of infection history. Using data from the CDC and the Food and Drug Administration, we've already established that vaccinations do not prevent infection or transmission of COVID-19. Let's take a look at how effective natural immunity is. A recent study by the Missouri School of Medicine and MU Healthcare found that 63 out of 9,119 patients with severe COVID-19 symptoms had contracted the virus a second time. That's only 63 of 9,119, less than 1%. Dr. Adnan Qureshi, who is a professor of clinical neurology at the MU School of Medicine, stated that this was one of the largest studies of its kind in the United States, and reinfection after an initial case is possible, though it's extremely rare. He also points out in his study that their analysis showed that asthma and nicotine dependence were almost always associated with those reinfections. Dr. Monica Gandhi, an infectious disease expert at the University of California, said that to deny natural immunity does not generate trust. And it's important to note that Dr. Gandhi does encourage individuals with natural immunity to get a single dose of one of the available vaccines. She recommends a single dose 6 months after your infection. And she believes that a second dose does not provide any additional benefit to those who have natural immunity. Study after study has shown that the efficacy of these vaccines are dropping as time passes. This drop in efficacy is why there's this new push for booster shots. New York physician Nicole Saphier stated that as vaccine efficacy wanes, natural immunity is taking its lead on our path forward. And ensuring access to effective treatments will be crucial to protecting the vulnerable moving forward. Vaccines are turning out to be a short-term solution to this pandemic. After 4 or 5 months, vaccines are less and less effective. And our policymakers know this, and now it's time that you know it too. So the next time that you decide you're going to shame someone who is unvaccinated, please remember that the facts and science show that the vaccinated are effective carriers and transmitter of the virus too. Science shows that if you're vaccinated, you have a significantly reduced chance of serious illness when you contract COVID-19. Science and data also show that people with natural immunity are less likely to be reinfected and carriers of the virus. You should make up your own mind, though, about what risks you're willing to take with your personal health. You should educate yourself before subjecting yourself to someone else's will over your choice for health care. I'd like to close with another quote from Dr. Saphier. She recently tweeted, "I'm not sure who needs to hear this, but opposing vaccine mandates is not equivalent to opposing vaccines. Trying to impose a vaccine mandate is like trying to insist that your 17-year-old niece stop smoking and vaping just months after her mother has died from lung cancer. You can give her all the information and support that she needs to make a healthy choice with her own life, but no amount of pressure is going to force her to do something that she doesn't want to do. Shaming her least of all." You can find links to all of my sources in the descriptions below. And if you found this video to be informative or added some value to your day, please let me know in the comments below. And if my sources are inaccurate, please share that with me too. If you enjoy discovery and learning, please like and subscribe and look for my future episodes of I Bet You Didn't Know by clicking the bell so that you're first to know when I upload new content. I promise the future episodes won't be so glum. They'll be much lighter and a lot more fun. I appreciate you taking some of your time to sit with me and watch this video.